Assalamu alaikum. Ultra scan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper maxillary, is the upper um, jaw, the maxillary region on both the right and the left quadrants. Now, on the posterior region, we have very limited bone available, so sinus lift will be needed for the right side as well as on the left side for molar implant placement. We've also gone ahead and placed a virtual implant for our doctor, which we will show you in just a little bit. But before that, I would like to show you that on the transaxial view, which is basically the proximal view, we have just approximately 2.6 millimeters of bone height in the molar region, and hence sinus lift will be needed. But prior to the sinus lift, we have to mention that there is a presence of a immense sinusitis in the upper right sinus, so this needs to be cleared out before sinus lift procedures can be initiated. When we move on to the anterior region, the premolar region, we've got periapical radiolucencies and bone loss, but we do have good bone levels here. If we measure in this region, which is the 4 and 5 region, we've got 9.4 millimeters of width with 13 millimeters of height. When we move to the anterior region, the ridge gets a little thinner, but we've got 5 mm of ridge width with approximately 16 mm of ridge height. The anterior region, we've got 5 mm of ridge width with approximately 14 millimeters of height. Something to note is that there is a canal which can be filled with any kind of nerve or a vascular structure. This is not the incisive foramen, mind you, please. This is the incisive foramen. But here on the anterior maxillary region, you can actually see that there are presence of canals such as this one. So this needs to be evaluated if it has any vascular bundles or any nerve structure. This is present on the left side of the maxilla as well, as you can see right there. We do, however, have a little bit better bone here. We've got 5.8 mm of ridge width with 13 mm of ridge height. Moving to the canine region, we've got good bone here as well, 6.3 mm of width with approximately 13 millimeters of ridge height. The distal most implant that can be placed here, it can be placed in this region, where we can place we have a 4.7 mm of ridge width with approximately 7 millimeters of ridge height. So again, the height gets lower, and as we move to the posterior region, we have again very little bone, 4 mm of ridge height, and no sinusitis on the left maxillary sinus. Now we've shown you all the measurements. Now we're going to show you all the implants that we virtually placed. Now these are all NeoBiotech implants. In a 0.3 mm decrease and a 0.3 mm increase in size is possible. However, we would not advise increasing the diameter in most of these implant cases. We've tried to place implants as thick as possible, but we will have limitations, and then again a slight bit of a margin of error can be expected, but overall 1:1 ratio, we're not expecting too much errors in our implant design. So these are all the implants that can be placed. We have shared a virtual implant report as well to our doctor, so they can actually have a better understanding of how these implants have been placed. This is the axial view. As you can see, every implant where we have better bone, we've placed in a thicker implant. Where the bone quality is slightly less or low, we've placed a narrower 3.3 or a 3.8 mm implant. If there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.